welcome to Career Landscapes, a peek into professional lives. Today we have the honor of speaking with speech therapist Tiffanie Turner. And I'm your host, Felicity Minch, for One Voice for Change. I would like to take a moment now and read a bit about Tiffanie. Tiffanie Turner is a bilingual speech-language pathologist with 19 years of experience helping young children find their voices, literally. She works primarily with Spanish-speaking children and their families, providing support for communication challenges by cultivating deep therapeutic relationships. She serves as the clinical manager at a pediatric home health agency in Colorado, where she leads a team of therapists and ensures high quality care, works directly with families, and mentors future speech-language pathologists, including students and clinical fellows just starting their careers. Tiffanie earned her bachelor's degree from the University of Arizona and her master's degree from the University of Memphis. She's passionate about early childhood development, preserving cultural and linguistic diversity, promoting self-advocacy, and empowering her clients to be active participants in their care. Tiffanie enjoys sharing her professional journey with students and hopes to inspire the next generation of healthcare professionals, maybe even some of you. Welcome, Tiffanie. Thank you for being with us today. Thank you.
Thank you so much for the opportunity to join you and talk
Oh,
about all of this stuff. Yeah.
oh, students are going to love this profession, and I think a lot of students have no knowledge about this profession. As I was talking to kids, they really didn't know anything about the profession. And I've got two kids right now just really anxious to see this video because they just are just thinking about the profession, and I think this will tweak their interest.
Yeah, that's great. That's so exciting. And it's interesting that you say that because the more people I share with what I do when I meet them, they kind of don't know what it's all about, but then we start talking about it and they're like, "Oh, I had speech therapy as a child," or my cousin did, or my best friend did, or my grandma did when she was in a nursing facility, or when she came home from that hip surgery. So a lot of people know someone or have been touched by speech therapy in their lives, but they kind of don't think of it as a career path. And
Mhm.
so it's great to be able to share it.
Oh, great, great. Well, we'll open up with tell me what it is and what kind of problems you solve.
Boy, well, it's a really vast field that's grown a lot over, I'm guessing, about the last 100 years or maybe 75, something like that. I should probably know that, but really, it is a field where we study and look at a vast variety of different communication disorders. So that would include things like stuttering, or after a person has a stroke, sometimes they experience something called aphasia, where they have trouble finding words or speaking again. We see any number of things like children. Mostly what I work with are children who have just like a language delay. They're not talking as early as they should. They need some help learning how to, develop their vocabulary. And then we see a lot of kids who just, they have a hard time making their sounds. And so they need help to, maybe get the right sound in the right place so that we can understand them better when they talk. We've all run into a kid where it's like, oh boy, I can't understand anything he says. And, that's kind of what we work on a lot of the time. Um, and then we work with a lot of families who have children who might have autism or Down syndrome or some other identified reason why they might have a hard time communicating. And then some kids are just super healthy kids who are just delayed in one or two or three different areas of development.
Mhm.
We also, I mean, it's also a field that helps people if they want to just improve their English language skills and sound more like a native speaker. Like if somebody's an international student and they really want to improve their English, they can go to an accent modification speech pathologist. And then some people in our field also work with people to, after they've gone through like a gender transition surgery, to develop their voice to sound more like their voice, like they want their voice to sound to match their gender identity. So there's a lot that you can do. You can work from, from very, very young infants and toddlers, like what I do, all the way up through the whole lifespan. There are speech pathologists that work with people of all ages, from, birth to death. And so it's a really vast, fascinating um, field that has a lot of variability.
Right.
Mhm.
Incredible. What degrees, what, what does a student need to get a degree in to become a speech pathologist?
Yeah, so I think every program has a little bit different name, but you would need, in order to be a practicing speech language pathologist, you would need a master's degree, and that could be a Master of Arts or a Master of Science, depending on what program you're at. Some schools offer one or the other. Um, and so that's usually 2 to 2.5 years of additional study beyond a bachelor's degree. Um, and that could be in speech pathology. Mine personally says audiology and speech pathology, but I'm not an audiologist. That's just the name of the title. And then a term that a lot of universities have moved to, especially I think at the bachelor's level, is they call their school like communication sciences and disorders. So that would be like a search term that you might use to find programs that would have something in that area.
Right. One of my high school kids, a senior, asked if there's been a change over the years. Has it become, is language becoming harder for any reason, or have we just identified the problem and we recognize the problem?
That's an interesting question. So maybe getting at, I want to make sure I understand the question, but asking like, are we identifying more people who need help because language is getting harder to learn? Is that kind of the
Yeah,
question?
she just wondered, I think she was asking, um, have the problems become more pronounced now for any reason? And I think she's really interested in the brain, and she really doesn't know much about speech pathology, but I think she was, if I can clarify what I thought she was asking is, are the problems becoming more pronounced? And, is the brain, are the brains changing and is it becoming harder to speak? Because I don't remember, even myself as a kid, I don't remember kids having a hard time. But of course, the field didn't even exist years ago. So I
Sure.
don't know if the problem is becoming more pronounced or if we're just seeing that people need help and we've recognized that.
Yeah, I mean, that's a really, wow, there's a lot to that question, but I think I'll try and answer it in what I think might be the simplest way, is that, as our field has grown and it has expanded to include a lot of things that it didn't in its very early days. Because I think really it sprung from an interest in stuttering and how do we help stuttering. That was kind of like the seed of it all, right?
Mhm.
But I think as we've expanded into things more like language, and we've really gotten into like what is language and what is communication, and then science has just gotten better at identifying different, neurological problems and this diagnoses. I think we've got better at identifying what should we be able to do, and who's not able to do that, and how do we help them. So,
Yes.
as the field has grown, and medicine and science has gotten more advanced, I think that has created, it doesn't mean that there are more people necessarily with problems. It's just that we're better at identifying and helping those people, is how I
Yes,
would.
that makes sense. That makes total sense. I would also think the field had started too, not only with stuttering, but with strokes. I would think that people who had had a stroke and had lost, you know, speech abilities, that I would think that would have been an onset of speech pathology too.
Yeah, I wonder. I'm not, I wish I knew the history a little bit better as far as like, what kind of parts of the field
Oh
became
yeah.
like part of it as it has progressed. But I'm sure that is, I mean, that's been something we have been studying for a long time. And I think people who are really interested in neuroscience and the brain,
Yeah.
that's the kind of stuff where we have a lot more information about what does the brain look like when this happens, because those people get, MRIs or CT scans and things like that, and we can look at it. Whereas, with little ones, like we don't accept them into speech therapy and then scan their brains. Like we don't know what their brains look like unless they've
Yeah.
had some kind of reason to do that, like epilepsy or, an actual injury or something.
Mhm.
So, but there's a vast part of our field that is really, really steeped in neuroscience and ways to work with people when you're really interested in brain changes and, um, you know, um, brain injury or, like you said, like
Mhm.
stroke, those kind of things.
Mhm.
Mhm.
Oh, great. I'm trying looking here at all the questions. There's so many questions. We won't be able to cover them all.
Great.
Just yeah, what ages do you particularly work with? From what span of age do you work with?
Yeah, so I mostly work with children who are between birth and 3 years of age, and then a couple maybe like 4 or 5 year olds. I really work on that young set for the most
Mhm.
part. And have taken over the years, a couple who are a little bit more school aged. But yeah, my expertise or my what I really enjoy the most are those little ones as they're
Yeah.
learning and developing like those first words. Hmm.
Yeah. Yeah. And what does it look like? What do you do on your first when you first meet the little one and their families? What happens at
Yeah.
day one?
So on day one, and I think this is true of pretty much any day one for a speech pathologist, is you go in, you meet them, you um, get to know them and maybe their family, their caregiver, whoever's with them,
Mhm.
and you start doing some like informal assessment of what are their skills now, what can they do, how does that compare to other children their age. You're asking a lot of interview questions of the parent, what are your concerns, can you tell me about their history, what's their development looked like so far, where are you struggling. And we get
Yeah.
a lot of information about their health and their developmental history. We might do some formal assessment measures like a standardized test or like maybe what we call a criterion reference test, which just basically compares the child to themselves and not to other children their
Yeah.
age, just to kind of start to get a baseline for where are they, where are we going, and then by the end of that first session, hopefully we started to figure out, okay, we know about where they are, what their baseline is, where do we want to take them in the next couple of months of therapy, and then we write some long-term goals, we write some short-term goals, and yeah, and then we have an idea. We've started to develop a relationship. We've gathered a lot of information, and then I come home and I put all that information into a really robust report for the child's pediatrician, for the family, for other people who might be working on their team. Um,
Mhm.
and then we have kind of our treatment plan, and here's what we're going to do for the next 2 months, and then we'll reassess in 2 months and see, have you met those short-term goals? What are we going to work on next?
Interesting. You mentioned a team. What team do you work with? The
So
physicians.
yeah,
Who's the
yeah.
team?
So a child's sort of like, team would probably consist, of their family, of myself, of their pediatrician, of any other professionals that might be on there, that might be fulfilling some needs that they have. So, I'm working on developing their communication or maybe sometimes even their feeding skills. And then they might have an occupational therapist who's helping them with fine motor development or with balance or with working on some what they call sensory processing. So they might take in sensory information in a different way, or they might have a physical therapist. Maybe they're a late walker, or maybe they have a diagnosis that makes, regular like gross motor movement very hard for them. And so they might have this team of professionals working. Sometimes there's a nutritionist or a nurse, or if they're visually impaired, there might be a teacher of visually impaired on their team. So there's all kinds of different professions who kind of come together, especially for our kids who are more globally impaired and need a lot of different support to kind of make progress toward their developmental goals. Mhm.
Do you see that sometimes kids who needs help speaking often have other problems, or is there sometimes a speech just isolated to just speech
Mhm.
problems?
Yeah, we see both. We see both. Um, I would say, when I'm talking about those teams, right? What
Yeah.
we see for the most part is that most kids who come into what we call like the early intervention program, most of them need a speech therapist. And some of them also need other services. So we see a mix. There are a lot of times where I'm the only therapy provider in the home and I'm the only one doing that. And so, like, their team is like mom and me and the doctor, and that's it. And then
Yeah.
some kids do have that bigger team of, I need a physical therapist, I need an occupational therapist, I need, a nutritionist, I need possibly like a psychologist there. So it's just it depends on the child and what their needs are and what their diagnoses are, and where the family wants support for their child. Hmm.
Oh, great. It sounds so fascinating, especially if you love children. It's just an amazing career. I'm trying to look at all the questions. Oh, how do you measure progress? You said something like after 2 months you measure, but what is how do you actually measure progress?
Sure. So, what we try to do, and one of the things that you learn in your education is how do you write a measurable speech therapy goal, right? So, with the children that I work with, often our goals are that we want them to have, you know, maybe 5 more words in the next period of time. Sometimes that's, depending on what kind of progress we think they're going to make and how impacted they are, like goals, like we write them in a way that we want them to meet those goals. And so I might say, in the next 60 days, this child will have, 3 new words, and we measure that possibly by parent report, by what I observe in therapy.
Mhm.
Um, or maybe it's like I want them to use a word to make a simple request 5 times for like 3 weeks in a row when I'm there. And so I'm counting, I'm taking data every time I go. I do that on paper, but a lot of young professionals now do that in some other sort of electronic way. And so then I can see from week to week, are they increasing the number of times that they do that skill that we've written a goal around? Is it decreasing? Do I need to adjust that goal? And so we measure progress by taking hard scientific data about what we see them do each, week to week, and what the family is reporting. And then we write goals in a way that they are measurable so that we can see, is there progress being made. Mhm.
Great. And another question, is stuttering still do kids still stutter? I just don't have any kids that stutter. And when I was younger, there were a number of kids that stuttered,
Mhm.
but that was a long time ago when I was in school. But it seems like stuttering is not as much of an issue now. Is is it, or how has stuttering
That's
developed?
that's a great question. Yeah, I mean, if so, in my practice, um, I don't see as much of it as I see other things, because a lot of
Mhm.
times my kids are not talking yet when we get started, right? But it does still exist. It's still
Oh,
happening, and I would, without being able to, check in the moment numbers, I would venture to say that it is probably as prevalent as it was, 30, 40,
huh.
50 years ago. Um, but I think, again, like, we've gotten better at identifying it earlier and
Mhm.
getting kids help earlier.
Yeah.
And um and I think that therapy has gotten more, I don't know if I want to say more effective, but it's more robust. People specialize in it. They really give kids and families a lot of tools for how to be a stutterer,
Mhm.
and so, yeah, I would say that it's still out there. We still see it. Um,
Huh.
the way that I often see it in my practice is what we call developmental disfluency, which is like they're learning language, they're learning speech, they're starting to stutter, and it's part of the typical development process. And then it, after a period, it goes away. And then our job is to kind of figure out, oh, is this child at risk for being a lifelong stutterer and needing, support to really get through that? Or is this something that we think is probably just developmental? And once they
Huh.
kind of get caught up and the load is less, then it kind of fades away and then they outgrow it. Yeah. Yeah.
Oh,
hmm
it's so fascinating.
Yeah.
It's just
It really is.
incredibly fascinating. Um, yes. And oh, a 17-year-old did ask, a high school kid, what's your favorite part of the job?
Boy. Yeah, I mean, I would say my favorite part, because you can imagine it's got a lot of bits and pieces that are not this, but my favorite part is, you know, because I work in people's homes and I get to go and be in their space, is just getting to their house and sitting down on the floor and really like it looks like a lot of play. I'm sitting on the floor with these toddlers, helping them learn how to communicate and just being in their home with them, having fun. And they're excited most of the time. They're excited for me to get there. They're sad when I leave, and it's just fun because you're just in that moment, living in the moment with the child, right? Like you're not writing reports and doing administrative work and all the other things that come along with, getting reimbursed by insurance and all of those things that are kind of on the outside of it, but the actual therapy and the relationship of it, I would say is my favorite part. Yeah.
And how long are sessions, or is that dependent on the client?
There are a lot of factors. Most of my sessions are about an hour long. And 45 minutes to an hour, depending. With, older children, you can get a lot more work done in a shorter amount of time if they're focused and they've got the attention. But every setting is a little bit different. Some settings similar to mine do, 35-minute sessions or 30-minute sessions, and then they can see more children in a day. Or if you're in a clinic setting, you might have group sessions, or you could set them up shorter or longer depending on the needs, and then also depending on just what how your organization is set up.
Yeah. Yeah. Is it usually once a week, once a month, or again, is that dependent on the client and
That's
their
again
needs?
dependent. I mean, most of mine have been one time a week. But you can, make a case for, oh, if this certain diagnosis responds better to shorter sessions more often. You can make a case for that, or this family has availability and they want twice a week to kind of really get intensive and work on it more for a shorter amount of time. You can do that. It really, again, yeah, it's dependent on the needs of the child and the availability of the therapist and the family and how your organization is set up.
And what is the role of parents? How do you involve the parents and what is their role?
Yeah. Um, so when we talk about like home health and early intervention, like the parents have a huge role because they are, you know, they're the adult in the room, and so they've got some responsibility. The idea is that if I can come in and sort of teach, educate, train you to do some of the things that I do throughout the day, then that child is getting more therapy than just that 45 minutes to an hour a week that I would come in and do. So there's a lot of emphasis placed on educating, training, teaching the caregivers. And sometimes that's older brother or sister, sometimes that's aunt, uncle, grandma, sometimes that's a foster parent. There's a lot of different, family units out there. But but there's also, in my opinion, some leeway or some flexibility around, does this family have the capacity to absorb what I'm teaching? And can they really put in the time, or do they, have a really hard situation? Is their life really, really stressful? And can I just kind of hold this for them, at least for a little while they're getting stabilized or getting back on their feet, or like just needing their attention to be placed on their other children or on their job or putting food on the table. So it's another thing that I enjoy about the organization I work for is that there's a lot more flexibility around um, how do I collaborate with the family in a way that is culturally sensitive, that is sensitive to just their personal situation, that lets them be involved as much or as little as they want from week to week.
Yeah.
But ideally, like if I could have the perfect situation, it would be really, really great to have them just implement what I teach them every week as much as I need them to. But life um, doesn't always allow for that.
So are the families or a family member with you while you're working with the child always, or are you alone with the child sometimes?
I mean, there's always somebody there. And then, sometimes they're sitting on the floor with us playing, sometimes they're sitting up on the couch, sometimes they're in the other room cooking a meal for the family or, but there's always someone there. I'm not ever like in the home just with the child by myself. Yeah.
And is this a career that is growing? And is this something that's going to be really needed in the future? Is this a growing field?
I would say so. I think like a lot of places or a lot of careers in healthcare, um, there's always going to be people who are sick, people who need help with certain things. And I feel like there's constantly in our community a growing need where we don't have enough of us to do the job. There's always work, there's always too much work. Um, and it's yeah, and I think the other part is that it's easy to work yourself into like oh, I don't want to do this job anymore. And so then people, I don't know if that's true in our profession, but I think in healthcare in general, it's like it's easy to burn out and then leave. And so that creates more need. And so I would say it's not going anywhere. I think the need is gonna continue to be there. We're gonna always have, you know, um, we're gonna always have kids and adults who need help learning to or relearning to communicate, to speak, to um, um, socialize, to, for some speech therapists who need help, with their eating, with their swallowing. There's always going to be a need for that. I can't see it going away. Yeah. hmm
And if you ever, I can't imagine this for you, but if you ever did get burned out of working with children, can a speech language pathologist move on to other areas, or do you have to be recertified or get a different degree? How does that work?
Yeah, the beauty about this profession is that, like I said, you can work birth to death. You
Mhm.
do not need to go back and get a new degree. You can change careers without changing your profession, without changing your certification. Um, I could decide tomorrow that I am done with the pediatric population and I want to try and work in a skilled nursing facility or an acute care hospital or um, in a high school, or maybe I want to go and work in a university clinic with a broad range of different needs. And so what it really takes to make a change like that, in my opinion, is just finding a position that's interesting to you, that has somebody who's willing to mentor you through that transition and get you sort of caught up in a field that's not hasn't been your specialty area or your expertise,
Mhm.
so that you can learn a new
Mhm.
expertise. So it's just, connecting and making relationships and finding somebody who is willing to yeah, help you make that change.
Yeah.
Mhm.
And does every school have a speech language pathologist on staff?
Let's see. So I don't know if every public school has, so I would say no, every school does not have one because we have schools that are not public schools and they do not have to. Um, Public schools either have a speech pathologist or more on staff, or if it's a small community, you might have one that's employed by the district who travels between schools to see all the kids. So it depends on, is this an urban, a suburban, is this a rural community? What's the need? And then public schools have to, as part of the Individuals with Disabilities Education Act, they do have to provide certain services to kids who qualify. And so they have to have those services available. And whether that's having someone on staff or having somebody employed by the district who comes in to different schools.
Huh,
Yeah.
interesting. And one of my college kids asked, what are the most important skills that a speech pathologist should have? And I was talking to other people in different careers, and it's interesting. Some really, you almost need to be an introvert to work in that field, or it's easier. Some being an extrovert really helps being in that field. Some require tremendous patience.
Yeah.
Some careers you've got to just, you don't care, you just go 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 go. So yeah, what various skills would be good for
Yeah.
speech pathology?
You know, there are many, I would say, and a lot of what you're describing, I think describes a lot of us, but I think a huge one is that you are um, kind of dedicated to lifelong learning and that you're able
Yeah.
to, um, when you don't know something, that you
Mhm.
are able to say, well, I don't know anything about that, and I'm going to figure out how to learn about that. I'm going to find the class. I'm going to talk to somebody who knows it. I'm going to read about it, listen to podcasts or take a continuing education course, whatever it is, um, in order to develop that skill. You might have a child in front of you who has a, a diagnosis that you've never worked with before, that you've never heard of before, that is just, you know, he's just himself and you've never met a child like him before and you don't know how to work with him or an adult, and you just have to figure out like so I think being resourceful and being a self-motivated learner are huge because you go to 4 years of undergraduate school, you go to two and maybe 2.5 years of graduate school, unless you get a PhD, which then is more, which you don't need to practice. But like the learning doesn't end there. Like it's just the very, very beginning because it's such a vast field. There's no way to know it all by the time you get out of school or even by the end of your career. There's just constant opportunities to learn, and you really have to be um you have to be willing to take that on, in addition to the work you're doing so that you can stay on top of what's new and what's what don't you know? There's just more that you don't know than you do know. And so I think that's a really, really big one. And then I think the other really important skill that I think it does take a career to develop, but is really, really valuable is just um, that ability to build rapport and relationships with people, because I feel like that's really where a lot of the progress and the healing happens for our clients is just in relationship with us,
Yeah.
so
Yes.
having a desire to really connect with people and meet them where they are is
Yeah.
also a really valuable skill, I think, in our profession across the lifespan. Mhm.
Yeah. Truly being a people person. Yeah.
I mean, maybe. I don't know if I'd say I'm always a people person, but like in my work, I feel like like those one-on-one, like really, really getting and digging into it and developing something that's deeper than just, therapist, patient, or whatever. Like it's just there's something about developing that I mean, you don't really learn that in school. Like you learn all the clinical skills and all of that, but really being able to um yeah, figure out how to connect with somebody who's having a hard time connecting. And that's what communication is all about, is like just connecting with other humans. That's how we all connect. That's how we develop relationships with one another. And so it's such an important part of our lives. Yeah. Hmm.
It's interesting because I've had several kids come to me and they say they hate to talk, but all their feelings come out in the guitar and in their music lesson and at home, and they certainly can talk. They don't have a problem, but they're so quiet. They want all they want their music to be their language, and
Mm,
it's a beautiful thing. So, and same with music. I work with people one on one, and you've got to have those relationship skills, and you've got to be able to see things that they don't see in themselves, and encourage them. Be very encouraging, very loving, very patient. Um, yeah, it's yeah. I love what I do, and I think you love what you do too. So,
yeah.
and what's the hardest part of your job?
Boy.
Is, I mean, some people have really long hours. Some people have, well, there's numerous problems in different jobs. But
Sure.
yeah, what would be the hardest, do you think?
You
The
know,
most difficult?
I think one of the most difficult things, and I guess I don't know if this is universal for speech pathologists or for me personally, but
Mhm.
is that there's a certain amount of um, I guess like heartbreak that can come from um, feeling like maybe you're not being as effective as you can be, or seeing that, oh, that wow, they're not making the progress that I'd like them to make, or some other difficult situations. It's like, again, we're in people's homes. We
Yeah.
see a part of their life that a lot of, more like outpatient settings or like the school settings, like that people don't see. And so you kind of are exposed to like, what's their home life like? And
Mhm.
sometimes it can be heartbreaking to see,
Yeah.
how the living conditions that some people survive, that, you get an eye on what maybe their relationship is with their family and how that might be hard in a lot of ways. And so you witness things that can just be hard to see and hard to take. And so we tend to take some of that on just because, we see it directly. And so I think it's a hard part of the job, but it also, I think, opens you up. Um, to feel compassion and also be reminded that everyone is really dealing with a whole constellation of things that we don't know about that's happening behind the scenes, and that all of that plays into their healing and their process and their how they show up in the world. And
Yeah.
it helps remind you that, oh yeah, like it's not just the kids I work with, but everybody that I come into contact with every day is, is dealing with hard stuff.
Yeah.
Yeah. Yeah. So that's hard, but I think it's
Yeah.
all there's some beauty to it as well.
Yeah.
Yeah.
Great. Well, I think I've covered all the kids' questions and my questions. Is there anything else you feel like you should add, or is there anything I've missed?
Oh boy. I mean, we could talk about this profession probably all day long, but I mean, I think your kids have asked some really excellent questions. I can't think of anything in particular, but yeah, I think they've done a really nice job. Yeah.
Well, I close every interview with three questions. And the first one is, what advice would you give young people? And
Mm.
you can speak to the question either as professionally, give them professional advice, or just in general, life advice. I mean, what do you see? Um, yeah, what advice would you give young people today?
Yeah. I have a few things, and when I first saw this question, I kind of went right to like, what are all the things that I am trying to teach my son about, and what do I want him to know, and what do I want his friends to know, and that generation. A few things kind of stood out and just sort of came to me, and the first one was just, um, you know, be that person who consistently shows up in life for other people, for yourself. Go to the optional practices, go to the extra rehearsals, do the things that kind of put you above and beyond. But also, like, if you see someone needs a little help with that job, but they haven't asked you to do it, step up and just do it. Be the person who shows up. Go to your, and I'm seeing this now, but like, go to your, when your friend has a performance, go to it and support them. When you're, I don't know, there are a million examples out there, but it's just like, show up for
Yeah.
yourself, show up for your friends, show up for your family, show up for people you don't know. Just, you know, be a positive presence, you know. And so that one is kind of really stood out for me because I feel like that's been a running theme in our lives just as parents,
Yeah.
right? Um, and the other thing that really I think is super super important, and I think kids are getting back to, is just find your people. You know,
Yeah.
like find your tribe, get out there and do the things that you enjoy, because your people will be there doing that thing and you'll find them, you know, like do what makes you, like what gives you a spark, what makes you excited, and your people will be there, you know. But it's like we're so, like I was saying before, we're a social species. We strive for connection, and so much of the world right now is set up in a way to kind of, it connects us with the whole world, and yet people still feel very isolated from one another and lonely. And
Yeah.
so getting out there, finding your community, creating community. If the thing that you like to do isn't available at your high school or wherever, get out in the community and find it. Those people are out there. And so I feel like that's just a really big one, because we need people around us to support us, to support in return. Um, and then the other, like the last thing that I wrote down for myself is, and I think that a lot of us are still learning this into adulthood, is just trust yourself. You know, trust yourself,
Yes.
trust your gut. If something doesn't feel right, don't do it. You know, if something feels good, you know, like go for it, but trust yourself. Um, it's just a really, really overarching big one that I feel like I want young people.
I teach that a lot to the kids, the guitar kids. I teach that all the time, to trust yourself, because kids always make mistakes, of course, on their instrument or whatever. And but you know, trust that you can do this. Trust. Yeah, it's interesting because trust is something that we don't even talk about anymore.
Mm,
It's our whole society is based on almost lack of trust.
mm,
So it's something that needs to be brought back. And
sure. Yeah.
yeah,
And if I can learn to trust myself, then I can
hmm,
try to extend that to other people,
yes, yeah,
right? Yeah.
exactly,
Yeah.
exactly.
Yeah. Yeah.
Great.
Hmm.
And then, yeah, the second question is, what gives you hope in this world?
This is a tough one, but I think when you really look for it and you have those antenna up, right? Like there are people everywhere who are doing good things, who are helping people, who are showing up, right? Who
Mhm.
who really want to um, leave this world in better condition than how it was given to us. Like I think there's a lot of positive stuff happening. Um, and so I'm hopeful about how the possibility of all of that, even though I think it's hard to see sometimes. Or currently, like it feels like it's really hard to see. So, I mean, you know, I'm hopeful in, you know, in just seeing glimmers of that in, you know, even in my son and his friends, you know, like they do a lot of that, showing up for each other. Like you hear about how, oh, like teen boys don't know how to have friendships, and they don't know how to, you know, communicate, and they don't know how to, you know, like they get a lot of grief about not being good citizens, but I don't think that's true. You know, I see them supporting one another, you know, coming to each other's, you know, karate tests, and coming to each other's cross country races, and their band concerts, and cheering each other on, and teammates helping each other set these ambitious goals for one another, and supporting and just being really great friends and citizens and students with each other. And that gives me hope. It's like, no, like they know what to do, and they're figuring it out, and they deserve more credit than they are getting, you know. Yeah. So that gives me hope. as a
Mm.
mom and a human. Yeah,
Yeah.
yeah.
And I truly believe, especially running the nonprofit, One Voice for Change, I have found there are so many people who truly, truly care about other people and they want to be involved to help other people. It's not for themselves. They're, they're not looking, there are so many good people in the world and we forget that. The
Mhm.
majority of people really have good hearts. We just have
Yep.
to give people a chance to show and to give them opportunities to show up. And I think kids need that guidance to say, hey, there are great opportunities out here, and there are great things you can do, and we just have
Right.
to, yeah, we have to keep it going and keep the hope going. So that's what I just think. I just love people. So I think there are so many great people in the world. And I guess the third question is, who inspires you?
I mean, I
It
feel
can
like
be more than one. It can be more than one person.
yeah, I mean, I am inspired every day by, again, by my son, by my husband who, um, they're both hard workers and um, they have multiple interests and they find time um, to cultivate those interests, I'd say that my son really inspired me to learn music again. Years ago when I started taking piano lessons, it was like I was watching him with you playing guitar and being like, wow, it'd be really fun to pick up an instrument um and now with, ukulele and just like, oh wow, like there's room in life for all of these things and to cultivate, a passion for something new or to just pick up a new hobby or and just put like some good
Yeah.
stuff out in the world. I'm inspired by um, you know, people who are continuing to do good work even when it feels hard or who come up with these amazing ideas for um, for ways to do that, right? Like how they have these brilliant ideas, like they want to start a foundation or they want to like create like what we're doing right now or um, you know, ideas that just never come to me like of their own, but they really inspire me to want to like keep putting good into the world and keep working and um, keep mentoring and keep teaching and do that hard work even when sometimes it feels futile, like what are we working against? But that like those people who are just powerhouses of nope, like we're going to keep this train going and I've got new fresh ideas and here's how we're going to do that. Like that, I find that to be really um really inspiring. Hmm. Yeah.
It's wonderful, and it is wonderful that you've picked up new hobbies, and I think that's important too. I've gone back to dance lessons, so I'm dancing, and it's something that I've always loved, and I've gone back to that, and it's just so inspirational. But yeah, there are so many inspirational people, so many inspirational ideas, and
Mhm.
again, it's seeing the hope and seeing the good in people and seeing what's out there that's so good, and we always have to bring that to the forefront. So,
Right.
yeah.
Amen.
Oh my gosh. Thank you so much. It has been a delight to talk to you. It's been a delight. The students, everyone's going to love knowing about this profession. Thank you for your time. Thank you so much.
Thank you so much for having me, Felicity. It's been really, really
Yeah.
fun. Yeah.
Great. All right. All right. And everybody, you check out the links below about One Voice for Change and have a wonderful time learning about this. And I totally encourage students to look into this career. It would be a wonderful thing to do. So thank you, everybody. Thank you from One Voice for Change. And bye.